Hello, my name is Daisy and I'm your nurse practitioner today. What's your name?
Kayla.
Okay, and what's your birthday?
March 5th, 2002.
Okay, well thank you so much for coming in. Today we're going to do an assessment of your chest, your thorax, and your abdomen, just looking at your heart rates and things like that and how you're breathing. In order to do that, I'm going to be using a stethoscope, both the diaphragm and bell part, and I'll be touching you with my hands. Is that okay with you?
Yes.
Okay, thank you. First, I'm going to take a moment and use hand sanitizer and clean off my hands. Yes, you may. And so next, I just want to take a quick look at you overall. And I'm doing two things as I look at you right now. The first is I just want to see just if everything's symmetrical, if your chest is rising just normally as you're breathing. And I also just want to know, do you have any concerns with your breathing at this time?
No.
Can you open your mouth for me? Thank you. And can I see your hands again? You have nail polish, but I can still see that circulation going through your hands. Thank you so much. I'm also just looking at your chest to see if there's symmetry as you're breathing, and you're looking fine, thank you. And for a little bit, about 15 seconds, I'm just gonna watch you breathe normally. So please go ahead and breathe normally. Thank you so much. I'm going to take notes really quick so I don't forget my numbers. So next, what I am going to do is really just to look at how your chest is expanding as you breathe. And in order to do that, can I have you lay down, please? Thank you. So again, I'm going to put my hands on. First, I'm going to put my hands right here underneath your ribs. I'm going to watch my thumbs moving as you breathe in and out. And now I'm going to put my hands on your chest and do the same thing. Thank you. And you can go ahead and sit back up. Next, what we're going to do is we're going to look for something that we call tactile primitus. And in order to do that, I'm going to need you to work just a little bit with me by saying the word 99.
99.
And as you say that, I want you to say 99 as I put my hands on you, and I'm just feeling the vibration. So if you could just turn a little bit towards this way. You can turn your whole body.
Okay.
Thank you. And if you could say 99.
99. 99. 99. 99. 99.
Again.
99.
Thank you. And so now the next thing we're going to do is really do just kind of what we call just a tapping, and that allows me to listen as we go through. So I'm going to touch you on your front and your back as well, okay? And just continue to breathe normally, please. If you could please lean forward and cross your arms like this. Perfect, thank you. Thank you very much. Everything is sounding wonderful. So really the next thing I want to do is a similar tapping movement, just like I did before, but this time I want to do it just on your diaphragm, the lower part of your back right here, as you're taking in some deep breaths and letting it out slowly, okay? So once again, if you could turn just a little bit that way, perfect. And if you could take a deep breath in for me and let it out slowly. One more time. Again. And one last time. Thank you so much. So now what we're going to do is I'm just going to actually use my stethoscope now, just as I said I would before, and listen to your breathing and just listen to some breath sounds. As I said, I'm going to use both sides, both my bell and my diaphragm. So we're gonna just start right here, and if you could just take deep breaths in as I put my stethoscope on. So breath in. Again. Again. Thank you. Everything is sounding quite clear. So now we're going to move on, and I'm going to look for 3 things that are going to have a little bit of partnership with you. In order for me to assess for these 3 things, I'm going to have you say a couple sounds as I listen to you again. The first one we call, excuse me as I pronounce this, a cacophony. And to do that, we're going to have you say just a long E sound, like a E. Yeah, so every time, just like before, I touch you with my stethoscope, if you can give that long E sound. Okay.
E.
Okay, you can stop between, but just when I touch you with my stethoscope. Go ahead.
E.
Perfect. And this is allowing me to hear a specific type of vibration in your lungs, just so I can tell if everything is clear. Now there's another vibration that I want to hear in your lungs, and that one is called cacophony. And in order for me to hear that one, I'm going to have you say a couple things for me one more time. This time, once again, I want you to say 99, just like we did before. But as you do that, again, I'm going to listen with my stethoscope. You only have to say it when the stethoscope is touching.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Thank you. That sounds really good. And we're going to do one last vibration test. And that vibration test is called the cacophony. And this one we're going to use a little bit, and bear with me in my pronunciation, and let me finish writing that down. This time what we're going to do is I'm going to have you say 99 again, but I want you to whisper it. So like a 99. Yes, once again, whenever the stethoscope touches. Perfect. Those fields are sounding really great. So now I'm just going to take a second and really just examine the front part of your chest. And as I examine your anterior chest, I'm going to have to touch again. So with that, once again, I'm just going to have you lay down as I just do some really quick touches, just so we can see this clearly. Is there any pain when I touch?
No.
Okay. And this allows me to see if there's any swelling, any bruising, if everything's correct. Go ahead and sit up for us. Thank you so much. So finally now, I'm also going to listen to what we call the Well, first I'm going to listen also to your pulse for one moment, just here in your anterior. So right here we have a pulse going right here, and I can feel for it and I can listen to it, and I know that things are circulating as they should. It's right here at the apex of the heart. Thank you, sounding good. So we're going to do one more thing where we have to engage in that kind of silly dialogue again. And this time I'm going to have you say blue balloons. And as you say blue balloons, what that is doing is it is allowing me to test for what we call tactile fremitus. And actually what we're going to do is as you say blue balloons, I will be listening and just listening to those sounds again.
Blue balloons, 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 blue balloons.
Okay, thank you. And so now I'm just going to do just a little bit of percussing, which is, again, that tapping of your chest. And so just bear with me once again as I touch. Okay, everything is sounding just as it should. Finally, I'm going to take, just to wrap up our breathing, I'm going to listen to your breath sounds. And I'm going to listen both in the front and in the back again. So bear with me as I get situated. Go ahead. Perfect. Just breathe normally like that. Okay, thank you so much. Everything is sounding good. And now what we're going to do is take a step away from our kind of respiratory, and I'm going to just look at your heart and how your blood's circulating. And in order to do that, I'm going to have you lay down one more time. And if you could turn your head to the left. And what I'm doing is looking at your jugular venous pressure. And so looking at it right here, I'm able to see it. I'm going to touch where I see it pulsating. Perfect, thank you. And what I'm going to do also is, did you have any tenderness? May I press on your stomach? I'm just going to press on it a little bit so I can just see it just a little clearer. Perfect, thank you. Go ahead and sit up for me. And now what I want to do is look at your carotid arteries. And so that means I'm just going to touch on your neck and feel your pulse over in your neck on both sides. Nice and strong there on both sides. Now, I want you to go ahead and stick out your arm for me so I can just look at your brachial artery here and feel that. Nice and strong, both sides, thank you. And so what I want to do next is locate what we call the point, the pulse of maximum of impulse. So that's where we really see your heart beating well. So what I'm going to do again is touch, just like I did with the other times, and just feel for that pulse right there. Okay, thank you. Now, just like before when I was listening to your lungs, I also want to take a moment to listen to your heart sounds. And I'm going to do a couple of things. I want to listen to it first, just normally, and then I also want to listen to it to see if there's anything off with your heart sounds, what we call thrills and britishes. And I don't think we're going to hear any of that, but I'm just going to go ahead and listen right now, once again with my stethoscope. Just for the first part, as I'm just listening to your heart sounds, I'm going to use the diaphragm. Then as I'm looking for thrills, I want to use the other side using the bell. And just breathe normally, please. Perfect. I see no concerns. I hear everything well. Everything is looking healthy, both with your respirations and your heart, with what I would expect for a healthy 21-year-old female. So thank you so much for taking the time to visit with me today.
Thank you.